Okay, I think we're going to get started. It's great to see so many people signed in. Sorry you've been staring at my face for a couple minutes if you started at the top of the hour. But good morning from California. Good afternoon and good evening wherever you're calling in from. Thanks so much for joining us. I'm Kat Lukach. I'm Chief Development Officer at Strong Minds, and I'm really delighted to welcome you to our very first Strong Minds Coffee Hour, which is a new series that we're launching to create a more informal, intentional space for staying connected with you. This idea emerged as we began navigating what has already been a year of significant change. Since January, we've seen growing uncertainty across the global development sector. When USAID first began winding down operations, the immediate impact on Strong Minds' budget was relatively modest, but the ripple effect across our ecosystem has been profound, and we continue to hear news of new threats. In Uganda, Zambia, Kenya, and Malawi, we saw really a wave of shock and strain hit our government partners. We saw HIV clinics close, internet at community health centers suddenly shut off, the same centers that collect real-time health data of every person in the community. These are the very partners that we work alongside every day to integrate mental health into national systems. In Uganda, when layoffs rolled out at USAID, some of those departing staff reached out to us, not in their professional capacity, but as individuals seeking mental health support. They asked Strong Minds to facilitate group therapy as they faced their own job loss and life transitions. Moments like that have underscored something we already knew, but now feel more deeply than ever, which is mental health is essential to improving lives. And even more specifically, our role in working to support governments is central to how we expand access to mental health care. We cannot treat depression at scale without the reach, legitimacy, and infrastructure of our government partners, from policy writing at the ministry level to service delivery in districts and communities. And yet, at a time when these systems are more stretched than ever, with shrinking budgets and reduced staff, we know our support must become more precise, more efficient, and frankly, cheaper. So we've been doing a lot of thinking and strategizing internally, asking ourselves, how do we adapt? How do we grow smarter? And how do we move forward in this changing time? We've leaned into one another at Strong Minds, only growing closer as colleagues, ideating and brainstorming how we take this catastrophe and catapult us into a future with even greater possibility. One that integrates technology and AI, one that identifies greater cost efficiencies, one that experiments with new business models to support our financial sustainability. And throughout all of this internal reflection, one thing has become clear. We at Strong Minds are firmly oriented in hope. Not hopeful in the sense of wishful thinking or blind idealism, but one where we see reality and refuse to accept that things have to be this way. So it's with the spirit of hope that we want to bring you, our partners, closer into that conversation. And that's what these coffee hours are all about. So starting today, we'll be holding them quarterly. Each one will follow a predetermined structure, tailored to what's most relevant at the time. Today's session will feel a bit like a round robin. So first, you'll hear from Sean, our CEO and founder, and then you'll get to meet our new COO, Mona. Finally, we'll turn to our country offices for some brief updates from Uganda and Zambia. We won't get too deep in the weeds on this one, but we've reserved a full 20 minutes at the end to hear from you. And we do want to hear from you. And that's your time to ask questions, share thoughts, or just reflect alongside us. So quick couple of housekeeping items. This is not a webinar. You have full access to unmute and turn your dials on your video. So at this time, please keep yourself muted and please keep your video off. You're welcome to use the chat box throughout the hour. We would love to see comments and responses or even your own hashtags. But we will not address questions until the end. And then during the Q&A, we ask you to please raise your hand or type your questions into the comments and we'll get to you. So without further ado, I hope you have your coffee or tea, settle in, and thank you for being with us. We're really grateful for your partnership and we're just excited to try something new together. All right, so Sean, over to you.
Hi, everybody. So glad to be with you. Thanks for joining our coffee hour today, wherever you're coming from. As Kat mentioned, this year with so many changes, a lot of organizations in our space are really struggling. What I'm so proud and excited about, though, is at Strong Minds, we are more optimistic and enthusiastic about our work and the future of our mission than ever. In many ways, our organizational dashboard is bright green, and we're excited about what the future holds. I'm just back from a couple of visits to Uganda and then most recently in Zambia. We're really our team, the excitement, the passion, the results that they're generating is very strong. Their excitement is palpable. I spent a lot of time with our government partners in both countries. They are so excited about the collaboration that we're building and strengthening, and they're so excited about the future. So for Strong Minds at Us, we just see tons of opportunity in the future, as we always have, and we're just so just again, a lot of excitement around that. There's a couple major points I wanted to highlight in the brief few minutes that I'm with you this morning. One, I think many of you saw just last month, we celebrated reaching patient cumulative number 1 million for Strong Minds, which for us was so exciting. And that was really over the first 12 years of our existence. I remember back in 2014 when we first started, we treated 514 patients. So to finally cross that 1 million mark, it's just so phenomenal for us. And we're really doing that now 100% through government collaboration. Strong Minds does not operate any of our talk therapy groups anymore because of the collaboration and the deepening partnership we have in our countries. I really believe that the Strong Minds mission of democratizing depression treatment is working, and we're seeing that as we scale with these governments. It took us 12 years to reach the first 12 million. That felt like a really long time, but it's only going to take us 18 months to reach the next 1 million. And that's really just strong evidence that our scaling and collaboration through governments is working. I think that's undeniable. And that's so exciting to cross the 2 million at the end of 26 or so. Another highlight I wanted to share is our Innovations Lab, which we've had in existence now for a few years and has been so instrumental in moving us forward in iterating our model at the Innovations Lab. That's really where we created our current 6 week therapy. Back in 2014, we're at 16 weeks of therapy. So the Innovation Lab has allowed us to get faster and better. Also, last year in the lab, we deeply piloted and explored single session interventions, the whole approach that you can possibly treat depression in a single session. And there's a lot of research from the West that shows that. But for us, as Strong Minds continues to speed up the iteration of our model so we can make it faster and cheaper in a good way. We're further investing in the Innovations Lab. We see that so important. In many ways, the Innovations Lab is really the learning laboratory for our government partners. We're doing all this research and development for them so that they can take our model and go further. So, with that said, we've just reinvested several $100,000 above and beyond the current budget in the Innovations Lab because it's so important to us. Other highlights, what we're working on, we're spending a lot of time getting ready to launch a full-scale, rigorous, randomized control trial. The RCT will come in just about a year from now, in about May of 26. Many of you know that Strong Minds, when we started back in 2014, we were based on an RCT in Uganda way back from 2002. Now, we used that kind of evidence of RCT in the first few years of Strong Minds because it made sense. But over time, as we iterated the model and changed the approach, the 2002 RCT was really just less relevant to us. So we're mindful now with all these iterations that we have that we really need a full-scale RCT with that rigorous evidence of impact so that we can not just share our learnings and understanding with the broader global mental health community, but also with our government partners as we continue to expand into new African countries, having that full kind of proven RCT. And we are quite confident, maybe too confident, but we're confident about the results that we'll see. Having that RCT will really open many doors for us. So we're incredibly excited to be working on that. We're actually right in the middle of a $1 million fundraising campaign for the RCT. If there's any interest out there, we'd love to talk to you. That said, the last point, I'm so excited in some of the changes in the improvement and the strengthening of the team that we've done in the last year. You've met Kat if you haven't already met her before today. She joined our team late in October of last year. And we were so excited to welcome our new Chief Operating Officer, Mona Al-Herbouhi, who joined us at the end of February. I'm incredibly just enjoying working with Mona, and I'm so excited to turn the mic over to Mona now. And again, thank you for being with us. And Mona, over to you.
Thanks, Sean. Can everyone hear me okay? Yeah, I will spare you the visual trauma of me being on camera just because I've been sick for quite a few days, so I apologize for that. Good morning and good afternoon, everyone. And thank you for the opportunity to share a few updates from the field. From my vantage point as the new CEO at Strong Minds, I've been at the organization now for just over 3 months. And I just want to start maybe by saying just how impressed I am with the dedication, creativity, and commitment to impact that runs through Strong Minds. I am really proud to have joined a mission-driven organization, and it's been an inspiring period of just listening and learning and collaborating with our teams across Uganda and Zambia and the global office. On the operations front, we've been really focusing on strengthening our core systems to ensure that we have the internal tools and processes that will propel our growth and support our delivery of still high quality mental health services to the next million clients over the next few months. One of the first things that I prioritized was consolidating our digital infrastructure, transitioning the entire organization to a unified productivity suite that brings everyone together. This might sound a bit technical, but in practice, it just means better communication across departments, faster decision making, better use of AI, and just more seamless collaboration across borders between the different country programs and our different departments. We're also rolling out a new goal setting framework called OKRs, or Objectives and Key Results. This framework will replace our old milestone system, and this will be the backbone of our new operational plan that will cover 2026 to 2028. I will ensure just everyone from our field staff all the way to our senior leadership is aligned on the shared priorities of the organization and is able to track progress in real time. But it also creates more agility and adaptability that will allow us to pivot more quickly when and if there is a need to do so. And as Sean mentioned, we're also revamping our innovations lab to explore new ways to adapt and scale our group talk therapy model, again, including digital and low-cost approaches that will build on what we've learned in the field so far and what we've learned from the innovations lab work over the last 2 years. For example, we're looking to test the feasibility of a near $0 delivery model. This eventually will allow governments to fully integrate our model into their existing health systems without substantial financial support from Strong Minds. This could be a game changer for our sustainability and the local ownership of our delivery model. We're also looking at revenue generation models that align with our mission, ways to offer low-cost, accessible mental health services to paying clients, which will generate income that we will then use to subsidize our growth and contribute to our near zero model delivery. It's part of our broader effort to ensure that we're using our funding to go deeper, farther, and cheaper with our service delivery. Looking ahead, what excites me the most is just how open Strong Minds is to challenging the status quo, not just to grow bigger and kind of in the traditional sense, like, a larger geographical footprint, but to grow better and smarter. There is real willingness here to ask hard questions and explore some audacious ideas. How can we reduce the cost per client to near zero? How can we integrate more digital tools without really losing the human connection that's so central to our approach? How can we be better partners to governments and communities? I see an organization that's really ready to not only scale its impact, again, in the traditional sense, but to make sure that the core of what we do is increasing access to mental health care in Africa through our government partnerships, through our work with communities. I'm really honored to be part of this journey. And thanks again for your support and for being a partner in this work. I'm really looking forward to exploring how we can continue to achieve those ambitious goals together. Thanks, everyone.
Thanks so much, Mona. Can't emphasize enough how excited we are to have Mona on the team. And although she's only been here a couple of months, it feels longer because of how fast and quick we're working together. So next, I'd like to introduce my colleague, Vincent Mujune. He is our country director of Uganda. And before I do that, one part of Strong Minds work that we've realized we just don't speak enough about is our work of advocacy. And this is at the country level, influencing policy. But one moment in particular I want to highlight is a recent distinguished opportunity that Vincent had last month in New York City, where he was invited to speak on a UN panel for the multi-stakeholder hearing on the prevention and control of NCDs and the promotion of mental health and well-being. It was a really big convening leading up to the high-level meeting in September. And global leaders, policy makers, and civil society actors all came together in discussion. So I want to share a quick clip from that meeting so you can get a bit of perspective at how influential this opportunity was and really how we are really approaching, a core component of our work includes coalition building and recognizing that we are one of many who are contributing to increasing emphasis and focus on mental health investments. So if my colleague Shireen could just cue that up for us. And then we'll hand it over to Vincent.
Governments in Africa, Strong Minds has learned some important lessons, and I beg to submit these lessons. Number one, moving towards the institutionalized and decentralized care works very well. And secondly, our clients do not lead single sector lives. And our policy and programmatic approaches cannot be single sector either. A multi-sectoral approach to mental health is a viable option. And to clarify this, I would like to expand this just in two areas. Firstly, decentralizing care away from the institutions towards the community is critical in bringing mental health care to people in their community. At Strong Minds, we've shown that we can deliver mental health care that is effective and cost efficient through lay providers and people with lived experience. Together with the Ministry of Health in Uganda, we have trained and supported community health workers to treat about 350,000 Ugandans for depression. Community health workers can play a critical role in decentralizing mental health care, especially in middle and low-income countries. And their fair remuneration must be also part of what the nations consider as their mental health priority. And secondly, mental health care has to reach beyond the health sector. And Strong Minds has continued to build partnerships across a number of sectors, but for the benefit of this meeting, I'll share the three examples that stand out.
And we'll pause there. If you want to hear the three examples, I know that was a cliffhanger. I am happy to share the link after this. So yes, let's hand it over to Vincent directly for some updates from Uganda.
Thank you. Thank you very much, Kat. Good morning and good evening, ladies and gentlemen. So glad to be here and to share some of the experiences that we have in Uganda about the great work that we are doing for Strong Minds. I am Vincent Mujune. I am the country director here at Strong Minds Uganda. I lead a team of about 140 staff members doing the work of Strong Minds and working in collaboration with government. A lot of the of my sharing will build a lot in the systemic work that we are doing with Government of Uganda and how this is helping us to reach the scale that we are aiming at. Our advocacy work naturally coexists within our mainstream programming, particularly to promote policies, funding mechanisms that support integrated, scalable mental health solutions across Africa and globally. Our advocacy efforts at the global and country levels seek to remove most of what we call systemic barriers and real challenges that make it difficult for communities to access low-cost and life-saving depression treatment within their systems of government. Strong Minds recognizes that governments in Africa are the main scaling partners in closing the wide treatment gap for depression on the continent. And by engaging with government departments, Strong Minds is able to influence governments to undertake reforms in policies, laws, cultural practices, and norms for the betterment of the mental health and well-being of adolescents, women, and men alike in our communities. An example that I would use in this particular case is that our advocacy work in Uganda began by demonstrating to the government of Uganda's Ministry of Health and Education how the Strong Minds model would help to treat depression among adolescents and adults within the government systems of health and education. And during our demonstration process, Strong Minds and the government of Uganda learned that achieving scale can be a daunting task if strategic barriers were not removed. And this would require having policies that prioritize delivery of mental health services in the community and promote mental health and well-being of adolescents and adults, promoting mental health beyond facilities and institutions of care would be a great and important policy agenda for this journey. In the laws of the country, we felt that having laws that decriminalize having a mental disorder or suicide would be helpful in creating a progressive and conducive environment for people to walk away from stigmatizing mental disorder and mental ill health. Regulations that deinstitutionalize care from the traditional national mental hospitals and permit access to mental health care within the community where people live would be viewed as more progressive enforcers and enhancers for the scaling of care. Cultural norms and practices that do not stigmatize mental illness and denigrate positive health-seeking behaviors among vulnerable persons are some of those progressive changes within the system that needed to be done or worked upon. For example, it's a common perception that a true African cannot be depressed. And those are really embedded so much in the culture and the thoughts, the norms of many cultures within Uganda, and working on those systematically would help to remove the barriers for accessing care. For the health sector, besides mental health being poorly financed as a specific sector, there are few experts as well to support the scaling of care in the community. The ratio of technical experts for psychiatry and psychology to the population are really desperate, and they would not allow real access, especially for the most vulnerable rural communities. Traditionally in the health sector, community health workers played a significant role in the fight against malaria. We know that they were critical players in fighting diarrhea diseases, HIV/AIDS, and vaccination programs. This was the first time community health workers would be viewed as a critical role, a critical actor and player in delivering community-based health care, particularly for mental health. Currently, the Ministry of Health recognizes that community health workers within the primary care system can play an active role in scaling treatment of common mental health problems like depression and generalized anxiety. In collaboration with the Ministry of Health, we have been able to train over 2,025 lay community workers to screen and detect depression early and provide first-line care. We've also developed standards for volunteer quality management to ensure that the quality of care is respected and the rights of vulnerable lay community workers are upheld as we scale the care through the health system. We've trained about 345 government supervisors to supervise the work of lay community workers and teachers to provide this community-based care for persons struggling with depression. We've extended community-based care for depression sufferers up to 132 health facilities in Uganda. And through these, we have reached about 350,000 people who were struggling and suffering from depression. Aside from the health sector, the education sector as well struggles with mental health as a very low priority area. The school weekly timetable did not have any time where students struggling with depression can attend the Strong Minds therapy while at school. This meant that students who receive the Strong Minds 6-week therapy would have to miss some of their classwork in order to receive therapy. This barrier was eventually removed when learners with lived experience of depression across Uganda were organized by Strong Minds to speak to policymakers about their situation. The students asked the Ministry of Education to create a mental health hour within their school timetable. And this led to the famous Circular 20, a policy document which implored all learning institutions in Uganda to establish a mental health hour within their timetable. And this was passed by the Ministry of Education to support the integration of mental health within the learning and the education system. Through our partnership with the Ministry of Education, we have supported about 485 public schools to integrate the Strong Minds model into the school system. We have also supported, we are supporting the education sector to roll out the mental health hour in all other public schools that are not necessarily Strong Minds program schools. And Strong Minds is supporting the development of materials that would help in the learning process to help children and students in school to appreciate their mental health and well-being at an early stage. We plan to double the numbers of students treated annually because of the growing trends and statistics that show that the burden of depression is having strong effects on education outcomes in Uganda. Strong Minds is helping the government of Uganda to also appreciate the multi-sectoral nature of the determinants for depression and other mental health problems. We have collaborated with the Ministry of Education and the Ministry of Health to establish an interministerial committee to provide leadership on how the government would scale community-based care for depression using a model district approach. You might be wondering, what is the model district approach like? And I would like to clarify that the model district is a government-led initiative for scaling the treatment of depression in schools, health facilities, and the wider community using the Strong Minds model. In the model district, the government leads the planning, the implementation, and coordination of mental health services across all sectors of government, while Strong Minds provides the technical assistance like training, skilling, and equipping community health workers and teachers and other lay providers with real tools to help them deliver quality care for depression sufferers within the district. Our end goal for the model district approach is to have the district health and education systems fully own and operate their mental health services without external support, providing a proof of concept that then can be replicated in many other districts within Uganda. In conclusion, our advocacy efforts work continually to help us remove a lot of barriers that exist in our work, and we see that our advocacy efforts are complementary to what Strong Minds calls its ambitious agenda for scaling the treatment of depression. We believe that with this complementary effect of the advocacy work, we are able to build stronger and trusting relationships with government actors and hold them accountable for implementing commitments and reforms for scaling depression treatment across all sectors of the country. I would like to end by saying that we are not just delivering therapy. We are building systems that deliver it to scale. I thank you for listening to me. Over to you, Kat.
Thank you so much, Vincent. Wow, there was a lot in there. I hope that everyone's saving their questions. And if you can believe it, Vincent's just scratching the surface on how much more he can go into. I know he covered things from advocacy and policy and collaboration with the education system and the health system, our quality and how we are really doubling down on ensuring quality throughout our approach to scale. And then the model district approach, which Vincent didn't mention this, but we piloted 1 district and we are growing that to 8 in Uganda this year. So again, just touching the surface of these, and we hope to spend more time on this in our Q&A section. But lastly, I'm delighted to introduce our country director from Zambia, Frank Harl. I will not elaborate any further. You'll get to see his sparkling personality in just a moment. Frank, over to you.
Hi, colleagues. Really great to see you all. I'm just checking you can hear. Is that okay? Yeah, Zambia's currently national environment in Zambia is the hardest it's been in decades, I would say. After 2 years of poor rains, the country now is experiencing nationwide blackouts every day, to the point that we only have 6 hours of guaranteed power every day, and often that's between like 11 p.m. and 5 in the morning when everyone's asleep. And crops, which mean drought and difficulty producing food, which has done nothing to help the cost of living crisis. Zambia has been experiencing inflation at about 17% year on year for the last number of years. And then obviously on top of that, we've got the US government pulling out of the country, which has resulted in a huge decrease in services. All of that to say that we're in a situation where the country is struggling and people's mental health generally is not getting better. It's been more stressed and getting worse. So the demand has increased and the need for our services are greater than ever. But just tagging on to what Kat said about hope and optimism, I'm so proud of how Strong Mind Zambia has grown to meet this need. We're not there yet. There's a long way to go, but we have gone from a staff-led operation of about treating 1,000-ish clients in 2019 at a cost per patient in 2020 of nearly $300 per patient to today, where we're going to be treating nearly 250,000 clients we're aiming at a cost per patient of just $6. Last year we managed to get just under 8. But the goal for this year is to bring that down even further. Just like Vincent said, how are we doing that? Through scaling the most effective, sustainable way, through the government and through volunteers. Volunteers that are community-based workers in the health centers, teachers, learners in schools, or our former clients, all helping us to keep our costs significantly low and build a sustainable solution way beyond even our organization, which makes us very, very different to other organizations that we work with. In Zambia, one of the proudest days was a couple of years ago where the Ministry of Education wrote to us giving Strong Minds permission to work in every single school in the country. So that gives us the green light to treat 8 million learners. However, doing that is obviously not a piece of cake. So one of the key things we're looking at is how can we do that? Who are the best people to deliver that talk therapy? Is it teachers who are overstretched? Is it learners themselves? Is it the community members from that school? We're piloting all of these innovative, exciting, forward-thinking, fast-thinking solutions to see what can work. We know we're worried with the US government pulling out of the health sector, but our solution is to work with volunteers on the ground, community-based volunteers that are there to stay. Very, very sustainable and very, very effective. So super, super exciting. If I think of how quick we've moved from staff-led therapy to volunteer-led therapy, how do we keep our costs down? We're keeping our costs down by looking at the number of staff to volunteers to client ratio, keeping that with quality front and center to make sure that wherever you receive treatment, by whoever, Ministry of Health, Ministry of Education, former clients, you're getting real quality, guaranteed quality treatment. And that is not easy, as you can imagine, going from 1,000 and change to 250,000 clients this year. You can see how our staff are all technical leads, oversight, supervisors, not doing any of the doing. Thank you so much. And I welcome hearing thoughts and questions. I can talk as well for a long time, but my internet bandwidth is bad because of the electricity, and I'll keep it short and sweet. But you're really welcome to come to see our work at any time. And thanks.
Thank you, Frank. Okay, everyone, that concludes our portion of speaking, and now we really want to hear from you. So whether you'd like to unmute yourself, turn your video on, and ask your question directly, or you can type it into the chat. We really intend for this to be more of a discussion and back and forth. And if you'd like to hear from someone specific on the team, please just voice that as well. We also, after this call, we'd also love to hear your feedback on, this is our first time doing a coffee hour, and we'd love to hear what you want to hear for our next one. With this one felt more of a kind of a macro level overview of our work and the different things that we're working on and strategically focusing in on. But we'd be happy to dive deeper into a specific theme for our next one. Any questions or feedback? Yes, Rebecca, please go ahead.
Thanks, Kat, and thanks, team, for a really excellent overview of the work and just what's been happening. There's a lot of huge milestones this year. Maybe my question is around the RCT, because obviously, RCTs are they're a big undertaking. They take a lot of time and resources. And I'm curious, and Sean, you kind of covered this a little bit, but I'm curious how you're thinking about what you would hope to kind of have at the end of that, and what's the kind of, if you have a initial partner lined up, and how you're thinking about planning for that. Because yeah, it makes sense as a kind of natural next step, but curious to hear more about the details there and how things are going in terms of fundraising too.
Absolutely. Sean, would you like to respond to this, and anyone else can add to it?
Yeah, I'm happy to. Thanks, Rebecca. Yeah, where we are in the RCT, very much in the thick of it. We're actually doing a pilot RCT right now in Uganda, and the main RCT next year is in Uganda as well. The pilot RCT is being done internally. It's really testing some methodology aspects. How do we make sure there's no cross-contamination? How are we selecting village communities? How are we training people? How are we kind of managing it all? So when we get to the main RCT, we've kind of worked all the bugs out of the system, if you will. So we're in the middle of the pilot right now. The main RCT, as I said, starts roughly in about April or May of next year. We've already selected our external evaluator, which is ID Insight. We've just signed the MOU with them. We went through a very competitive selection process. The main questions we're trying to answer in the RCT are really threefold. One, does the program work? Two, what are what are the well-being or secondary indicator? What is the well-being impact? Things like productivity increases, income increases, et cetera. And then the third is really the longitudinal aspect. How well does our program last over the long term? Typically, we always measure our program up to 6 months later, post 6 months. In the past, we have collected up to 2 years, but it's a growing question of importance for us and many of our stakeholders. How long does this program work? So that would be the third aspect. That said, RCTs are a difficult thing. You can have a great program and something happens out of your control that can possibly negatively impact the results. So we're aware of that. We're trying to mitigate and manage as many risks as possible, and doing the best job we can. RCTs can also be super expensive. We were very kind of cognizant of the funding environment, not just with recent changes, but mental health in general. There's not a lot of funding available for a big RCT. Ours will be a well-powered RCT. The budget won't exceed $1 million. And we're in the middle of fundraising right now. We're having some really encouraging discussions with a couple potential funders right now. As of this moment, the $1 million RCT for next year, we don't have any commitments against it in terms of the funding. And that kind of go, no go point in terms of we need the money to really make this happen isn't until November of this year. So we still have time. And again, because we have some positive discussions, we still feel optimistic that we'll get the funding. The pilot RCT will be informative and that we can still begin and conclude this next year.
Thanks, Sean. That's exciting. I'm glad to hear you've got the MOU signed and things are moving along. And yeah, definitely second to unexpected circumstances. As somebody started RCT in the end of, I think, 2019. We were doing one during the COVID pandemic.
Oh my
But
God.
you make it work. So it's great. And if we can be helpful for partners there, happy to kind of be in touch and brainstorm, especially around funding as well, because I know that's challenging at the moment. And yeah, so this is great news to hear as well, along with all the other wonderful milestones you shared today.
Thanks, Rebecca. No, we'd love to be in touch on any ideas we have on the RCT, so we'll reach out. Thank you.
Any other questions? Or just comments, and we're curious to hear your feedback on the format, and it sounds like this might work. So we'll at least take it to the next quarter. And any specific areas that you're wanting to learn more about. I know that Vincent, I feel like we've tried to articulate the model district approach several times. I've never heard it so articulate till you said it today. Well, we're very grateful for your presence and for your showing up and your interest and your partnership. And we are thrilled to continue these. We're thrilled for you to be with us on this journey as we continue to collaborate with the government, as we really continue our mission and live it out. Again, just to say that we are optimistic, and we believe that there is so much possibility in front of us. And so it's with your creativity and your ideas, we want to hear from you. So whether they're side conversations, we're here, and we want to continue this dialogue back and forth. And that's really how we believe partnership should be. So I guess at this time, if there's no further questions, just thank you again, and I hope you all have a wonderful rest of your day.
Thank you for joining us, everyone.
Thanks, everyone.
Thank you.